Yeah, hi, my name is Pravesh and welcome to AJINORAH, and this is Dr. Balian, Director of Ayurveda and Charcos. Alright, we have a couple of questions where you can get a better clarity on mental health nursing. Right? So, Doctor, how are you?
Yeah, I'm good, and thank you very much for inviting me. I'm really glad that you asked about mental health in nursing, because there are huge questions, queries, and a lot of confusion that people have about career in mental health nursing. So I'll be happy to answer any of your questions.
Yes, thank you, Doctor. So, Dr. Seema, what are the current opportunities in terms of mental health, and what are the exposures? I mean, how can we actually accommodate all our nurses?
Yeah, see, mental health is one of the branches which has always been in UK. So it is not, and I think that no healthcare is complete without opportunity of having psychiatry or a mental health services. But nowadays it is coming up as a more and more of a branch where there is a lot of recruitment opportunities and are coming up. So we ourselves are doing recruitment in mental health nursing for the southwest region in UK, and we are glad to sort of say that we are getting a good traction and already have placed quite a few nurses over there who are in various stages. So there are more than 80 nurses who are already been recruited, out of which there have been 30 nurses who are already gone to UK. They have appeared for their OSCE and have cleared their OSCE as well, so which is great, and now they are part of the NHS working as mental health registered nurses. So your question about the opportunities, then opportunities are immense, and I would like to take this opportunity over here to say that it is, see, there are lots of queries that people have and lot of apprehensions that they have, that oh, they don't want to work in mental health. And in some way I can understand it, because currently the people who are, especially like in India, if you are here, the mental health services are not as comparable to how the things work in UK. So things work in a different manner. In mental health, if you consider what exactly are the problems which come under mental health, then you can see the spectrum is huge. Like anything which is as simple as stress to anything going towards the really psychotic patient or like schizophrenia and all those things. But the general perception of people is always, as soon as you mention mental health,
Right,
they will be thinking at the extreme other end. That the people who are aggressive, violent, psychotic, or those are the things which come in their mind. And that is the reason that they get a little bit apprehensive, a little bit anxious about going and working in those fields. But I really want to tell you that this is not what it is. It is, you can say that 75% of the mental health is based around your stress, depression, dementia, Alzheimer's, old age psychiatry. 75% is around that. It's only a small amount which is going to that extreme. And even that is handled in a much better way. And it is not that the day one that you are going to be starting, you are going to be put in the extreme cases.
That's right.
So you will be given a lot of training and a lot of support in order to handle each type of cases which are there. So I want to reassure and I want to give this confidence to all of the candidates who are interested in working in mental health, that go for it. It is a real good opportunity. And please don't have apprehensions. It is like any other branch. And quite a lot of time, you will be dealing with people who are stressed, and along with that they are also suffering with diabetes or hypertension. So it is not that you are only working as a mental health nurse. Even if you have experience as adult, which is adult nursing, then it is great, because then you will be able to see their comorbidities and help with those as well.
That's right.
Yeah. So I hope that people will try and understand this, and people will be more willing to explore this as an opportunity.
Right. Doctor, then, that's been, covered most of the questions, but now, what are the other special requirements to get into mental health nursing?
So, like any other nursing field, the requirement for the nurses has to be that they need to complete their basic 3 years degree at least. So, anyone with GNM, with the BSc nursing or post BSc, or if they are MSc in psychiatry, that is going to be really great. Anyone who has experience in mental health will be very welcome. But even if you are a fresher, but you are, or a newly qualified, but you are really have a strong will to work in mental health, or if you want to make a career in mental health, you will be given an opportunity.
Perfect.
So this is one of the basic sort of thing, but along with that, you will need to clear your English exam with the required scoring, which is required for your NMC registration. And also, since it is a specialized branch, then you will need to register under the mental health rather than an adult nursing, because then you are going to be registered as a mental health nurse.
That's right.
So these are some of the things. Apart from this, obviously, once you have registered as a mental health nurse, you will need to give a mental health CBT and a mental health OSCE as well.
That's right.
But don't worry, we will be providing all of the support and training, because as you know that Aryabrat runs a OSCE cleared program, in which we are giving, not only helping you with your interviews, with your interview preparation, but helping you with the rest of the process as well, whether it might be your NMC registration or help with the training of OSCE. We do train the candidates in India as well for the OSCE before they fly out, and also once they reach UK, then we are also giving them the training over there. Yeah, and along with this, to the mental health candidate, we have also created a mental health foundation program, where there are various modules which are there, and while the candidates are waiting for their processing to happen, that is the time that we utilize these candidates to work on the mental health foundation program, which is also going to give them that insight of how they are going to be working over there, and what exactly do they need to know about the mental health in NHS or in UK. So they will not feel as if that I'm coming to a new environment, I'm coming for the first time. And good thing is that mental health OSCE is slightly easier than the adult OSCE, because the number of stations are slightly less.
Correct.
Although still a thorough practice will be required, which we are there to help you out with.
And doctor, the last question is, when are the upcoming interviews?
Good question. We are having very regular interviews. Every month we are having 2 to 3 dates of the interviews, and the next interview is on 6th of October. And we are recruiting, we are taking the CVs now. So anyone who wants to share their CVs can approach you guys, and you can share it with us. And I think that then we normally will be doing a mock interview for them in order to prepare them for the interviews. And mock interviews are conducted by our the NHS trainers, and or the trainers who had already have NHS experience, and then give full support to them at the interview to make sure that they are aligned with the all the media and all their internet and everything, and will be supporting them with that one. And we want to also say that currently we are also working on slightly a fast track program, that we would want to send as many nurses as possible before the end of this year. So if there are someone who is interested, please attend the interviews as soon as possible, and we'll reassure that you are there in UK before the end of this year. So you can celebrate Christmas and New Year in UK.
So viewers, I mean, it's up to you. I mean, decide. We have end-to-end solution in terms of your academic, learning part, as well as your OSCE and CVT training and the recruitment. So choose what's right for you. All the best.
Thank you very much, everyone. And I know there was a lot of information in a small amount of time, but I hope that you have understood it and that you are as excited as us to become a mental health nurse in UK. So good luck to everyone, and I hope all of you join us soon.
Thank you for your time, Doctor.
Thank you.
Thank you.
Thank you so much.